Welcome back to the LifeScan Diabetes Patient Support Program. In this short video, we're just going to go through the doctor's presentation that the LifeScan representatives can use when chatting to the doctors. Basically, the point of the program is to give ongoing support and education to the patients. We are not there to manage the patients on behalf of the doctor. This is the doctor's job. So please make this clear to the doctors that we do not want to overtake or take over their patient. We are just there as a support for ongoing education. And if anything needs to happen or anything is unsure, we'll push it back to the doctor that referred the patient onto the program. Okay, so we're just going to go through quickly this presentation. The presentation I've made as short as possible or to the point as possible, just so that we can your time with the doctor is quite limited. So we just want to get to the point and go over what the program's all about and how to use it. Alright, so this first screen is just about the common grounds. If a patient is diagnosed with a chronic disease and it's unmanaged, these are the symptoms and the cycle that they are in until they take control of the disease and manage it correctly. Alright, so that's the point of the program. The program is also there to drive compliancy on testing with the one-touch meters. So the concept is if a patient is testing when they should be, they have a better understanding of where they're at, and then they are more controlled and more compliant and have a better lifestyle. Alright, so the program introduction. Diabetes management principles. We'll give injection techniques based on the FIT program or the FIT techniques. Supply the patient with their free one-touch meter, and train on how to use it correctly. And then there's ongoing support and training. So it's a 6-month program. There will be 3 physical visits scheduled with the patient and teleconsultations in between at any stage that there might be a problem. We will send out a nurse or refer back to the doctor depending on the situation. Okay, so that's the outline of the program. Alright, the benefits of the program. There's no reason why a doctor wouldn't want to put this patient on the program, because it will be giving comprehensive holistic patient care and improved disease management. It will improve the quality of life for the patient, because you'll be better self-managed and better managed and live a better life. The program is sustainable, it's ongoing, and it's structured. It is evidence-based. It's from the Stanford University Chronic Disease Self-Management Program that we've based this on, which Curo Health has the license for Southern Africa. We'll also be getting data, so we can, as this program gets more and more patients, we'll get more and more data, which we understand and better the self-management program and how to for patients and how to educate patients on better self-management techniques, etc. All right. So that's the overall benefits of the program. The process, there's one process step before step 1 on this slide, which is from the LifeScan representative's perspective. They're obviously going to identify doctors that they want to approach. They will then get the doctor interested in the program and start getting them to put patients on this program, which then it gets to step 1. So the doctor will just go back one step, sorry. Once the rep is there and they want to load a doctor, they can do that directly on Nubis while they're at the doctor on their iPads if needed. Add the doctor, and because it's a live system, as soon as the doctor is added to Nubis, they are technically live. So right there and then you can also add patients and connect it to that doctor if need be. Okay, we've tried to make getting patients onto the program as easy as possible for the doctor. All right. So as soon as step 1, as soon as the doctor identifies a patient, they can then they move to step 2, which they can either load the patient directly onto the Nubis platform. You can just give them a username and password if need be. That'll be first prize because then they're more interactive on the system. The information they give is correct, and it is very, very simple. Or they can phone. There's a number that you'll see later on where they can phone the call center and add the patient on the program. They can then also phone a LifeScan rep. You'll also have permission. You'll also have access on the system to load a patient. This is obviously not ideal, but it can happen that they'll phone you, so you want to give you access to do that. The the call center will also, there's a process on that we'll go through a little bit later, and we will ask the doctor if it's a home patient or a hospital patient, so that we can send the DE to the hospital if needed, hopefully before the insulin reps get there, and put them onto our program first. All right, so that's step 2. Step 3, the call center will contact the patient and book an appointment that is convenient for them and allocate it to a DE in that area. That DE will then get notified on the NUBIS system about patients, and they will then go to the patient and start the process with the first appointment. The doctor will get a report after each appointment. We don't want to bombard the doctor with too much communication that's not necessary. So they will get, first of all, they'll get a logged status. So when a patient is loaded onto the system and it's linked to them, they will get notification that that patient is now has been logged, and we will contact them. Then the next communication they'll get is only when the nurse has seen the patient and what was discussed and what was given to them at that appointment. That report will be sent to the doctor. There's nothing in between that really that is necessary for them. So if we, for example, we won't go send, we try to call try to contact your client, etc. He didn't answer his phone. That type of information we won't send. It's only important information that the doctor that is relevant for the doctor will resend. Okay. So the program, step 1. Identify the patient. Step 2 would be the first appointment, where we'll go through the next slide. We'll go through more in details, but just an overview. We'll do a BMI, blood pressure. If the doctor wishes that we want to do for us to do an HbA1c, we will draw the blood and do that test. We'll give injection techniques and education from there. Step 3 will be televisits. Teleconsultations in between the first visit and the second visit, which happens at step 4, which is a 12-week assessment. We will do another HbA1c with the doctor's consent. There's more education there, and we'll go through the caregiver map. Step 5, between the second appointment and the third appointment, we'll do more teleconsultations. And then we'll have the final physical appointment at week 24, which we'll do another HbA1c and give further ongoing information that will to the patient, like diets, some diet information, and exercises that they can do. From an HbA1c perspective, we would like to do 3 HbA1cs in the 6 months, because obviously from when the patient was put on the program to the end of the program, this will give us a good indication on how the patient has progressed. Okay. At any stage, again, at each stage of that there is valid information that needs to be sent, this will be emailed to the doctor. Okay. The first appointment is quite important. It's going to take about an hour with the patient. It is a lot of information already that we need to get through, so we don't want to give them too much information. We just want to get them going. Then the teleconsultations and the second appointment, etc., that will give them more and more information. We don't want to overload the patient. So the first appointment will just be a general screening test to get us some base levels. We will hand over the one-touch meter and capture the warranty card and the serial number of the machine that we're giving them. We'll then go through injection techniques, storing insulin, etc., and go through the 4 C's of diabetes to just give them a good idea on what to do. All right. If anything is uncertain at this point, we will refer back to the doctor. What is important, we are going to go through the PMB registration. PMB, prescribed minimum benefits. If the patient is not registered with PMB, we will give them instructions on how to register with PMB. We won't register for them, but we will help them through the process. There's documents and things that they need to do, so we can't do it for them. But we will explain to them that if they are registered on PMB, their medical aid will be better managed. So not everything will come from savings accounts. The things that the medical aid is supposed to pay for diabetes, they will pay for. If they are registered with PMB, we'll discuss that and help them through that process. That does bring us to the point about the costs of this first appointment. If the patient is not registered, depending on what the patient is registered for at the medical aid, if it's chronic or PMB, etc., we will attempt to take the cost of this first appointment from another basket other than their savings accounts, but it could happen that this first appointment will come from their savings account until they are registered with chronic or or registered with PMB, which then the ongoing support can be taken from those baskets instead. Okay, this will also be discussed with the patient. Okay, just a graphic process. Again, the doctor will find a patient that they want to put on. They can either do it online or call the call center. This is the correct number for the call center, so they can just phone in. The call center will make the appointment either at home or at hospital. The nurse will add any comments and feedback onto the NUBIS system and what was discussed, what was handed to the patient, etc. And that doctor will get an email with what is discussed at that appointment, and that will be kept ongoing through the 6 months and further on if need be, depending if the patient stays with the program or not. All right. This is the basic overview of the document. If you want to make any changes or unclear or got any questions, again, please email me at Warren, WARREN, at Curo health.co.za. We're going to move on to the next video, which is moving on to NUBIS and how to use NUBIS. There's going to be a short test after this video just to get your understanding on the presentation, and then we'll move on to the next video, which is starting to you how to use NUBIS and register the doctor, etc. Thank you.